Drug maker Eli Lilly is planning to ask the FDA to approve a diabetes drug for weight loss. It's called trizipatide. The company says a new study showed obese people with diabetes who used the drug for a lengthy time not only controlled blood sugar but also lost weight. It's important to note the data has not been peer reviewed. Now, it's just the latest drug that could be approved for weight loss.
Yeah, could it be a better option, though, than diet and exercise for weight loss? We're joined now by Dr. Mir Ali. He is a bariatric surgeon and medical director of MemorialCare Surgical Weight Loss Center at Orange Coast Plaza Center. Thank you so much for being here. Good morning to you. So first of all, let's just talk about the efficacy, right? How effective are drugs like Ozempic for weight loss, and what are the pros and cons? Because we've been talking about this a lot, and are people misusing it for weight loss?
Yeah, these drugs are very effective for weight loss, more so than some of the other drugs that have been available on the market for much longer. And they started as, as you mentioned, diabetic medication, and they found a secondary effect as weight loss. So people have started using them for weight loss, and Ozempic has been approved for weight loss.
I know it's been approved. I think there's been some conversation about, obviously, if someone is diabetic and needs to take the medication to lose weight versus someone who just is, 10, 15 pounds overweight, is that really an effective use of the drug?
Yeah, the strict indications of the drug are based on patient's BMI. So if a patient has a BMI greater than 30, that would put them in the obese category, then they are qualified to have this drug. Now, there are patients who are using it off-label. They don't meet the criteria of a BMI of 30, have, like you said, 10 or 15 pounds to lose, and are using these medications. So the ethical dilemma comes up: are they taking them away from people who really need them, or is it reasonable to use it in that case?
Right.
Yeah, and if someone with other issues like hypertension, how effective is surgery to deal with, these issues long term?
Surgery is the most effective long-term for dealing with type 2 diabetes, hypertension, and other medical conditions associated with weight. There's a lot of data, there's a lot of studies done that show that weight loss surgery has the best long-term efficacy, resolving or improving these issues and keeping patients away from all these problems.
It may be the most effective way, but I don't know about you. I would like to avoid surgery as much as I possibly can. What are some of the other effective weight loss options if you want to do that?
Well, surgery is only for people who qualify to meet the weight loss, the BMI criteria. And so if patients don't meet that criteria, obviously the safest thing is diet and exercise. That has the lowest complication rate. But there are many tools available for patients to lose weight, and medication is one of them. The whole goal with any program, medication, even surgery, is to provide a tool for the patient to help them lose weight. But it's really up to the patient to make those permanent, long-term lifestyle changes that can lead to sustained weight loss and a healthier life.
I feel like in the past we've seen some of these other drugs come out. They've been approved. People take them. It works really well for weight loss. And then sometimes, months, years later, it comes out that the side effects really far outweigh the benefits of the weight loss. Is there a possibility that could happen in this case with some of these diabetes diet drugs?
It is possible. I mean, these drugs have been around for some time, so there is good data, long-term data on them. But and people who have been on them for decades. So, the concern is if patients use the medication and they stop and start regaining weight and resume the medication, what are the effects years or decades down the road? And that's something that only time will tell. But it's possible, but not likely, it seems to the research done so far.
Okay. Well, that's encouraging. Dr. Mir Ali, thanks so much for joining us.
It's 8:40 right now.